Hello, and welcome to Yodo.
I'm Dr. Lisa Tartaglia.
I'm Dr. Sarah Bone.
Thank you for joining us today. Today's topic is going to be on spirituality.
Spirituality is a concept that a lot of people don't recognize the importance of during palliative care, when a patient and their family are facing a serious illness or a terrifying diagnosis or trajectory of an illness.
Yes, and spirituality is something that's oftentimes neglected, and it does play a very important role in the pain management of a patient.
A lot of people also confuse spirituality with religiosity, and we're going to discuss what spirituality is. We're going to talk about how to address spirituality with patients, the methods that we use for spiritual assessment and taking spiritual history, the team member that often works with patients for spirituality, because we use a lot of team members with palliative care and with hospice care. And then we're going to talk about different communication strategies and how we approach those spiritual needs.
What do we mean when we say palliative care is for the whole person? A lot of times people don't realize that when we're treating patients with chronic illness, we do need to look at their mind, body, and spirit. So the whole person care might sound a little overwhelming if you're talking about a single clinician, but like Dr. Bone said, we work in an interdisciplinary team. So basically, we work all together to have the same results.
When a person has a serious illness, it affects their quality of life, it affects how they approach things, and it affects how they think about things, both cognitively and emotionally, how they think about things. And then, like Dr. T says, it's going to affect how their pain or how their symptoms are. So it all kind of interrelates, and we're going to discuss that a little bit today.
The interdisciplinary team is crucial, and the parts of that team is the medical team. It could be physicians, nurse practitioners, the social worker, the chaplain. All together, each of the disciplines work together in contributing parts of care for the whole person.
And certainly some of those team members' activities overlap with some of the other team members, but each one of us has gaps in our skill set or in our knowledge. But when we work together, we can close those gaps and we can better manage and address the needs of that patient and help that family navigate those difficult times.
For our purposes, chaplains are defined as people who are board certified routinely. They coordinate care with the community in the religious circumstance, spiritual, as well as cultural resources that is desired by each patient. It's individual.
And the chaplain does a lot of the heavy lifting. They carry a lot of the burden for our team when we're dealing with patients that have these serious problems.
To define spirituality, it's a dynamic and intrinsic aspect of humanity through which persons seek ultimate meaning, purpose, and transcendence, and experience relationship to their self, family, others, community, society, nature, and the significance of being sacred. Spirituality is expressed through beliefs, values, traditions, and practices.
Where religion is more of how that individual reacts and interacts through a community type of environment. So it's more of a structure or an organization. That organization has certain practices, certain traditions, certain relationships, and how that individual practices their religion is more defined by that organization itself. You could think of religion and spirituality kind of having a similar relationship to each other, where all religion is spiritual, but not all spirituality is religion. And I kind of compare that to breakfast cereals, just to be simple. I'll say that all Fruit Loops are cereal, but not all cereal is Fruit Loops. You have the broad category of spirituality, and religion fits inside of that broad category of spirituality.
Why do we want to focus on spirituality in hospice and palliative care? Spiritual care is an important patient need in palliative care and hospice, and spiritual distress is a significant component over the overall distress of a palliative care patient. So what I mean by that is some patients may have overt pain, and you're treating the pain thinking it's physical pain, but it could be an emotional or spiritual pain. So it is very important for you to do an assessment of spirituality.
And we want to address the patient's quality of life. We want it to be the best it possibly can. We want every day to try to have the most alleviation of their symptoms if possible. And good quality care means that those symptoms are being managed. So we want to manage total pain, physical pain, emotional pain, and spiritual pain, because they all interact, they all interrelate.
And you also want to make sure that you work with the family, because sometimes families bring stuff to the table to the patient that causes them undue stress.
Quality of life, we've mentioned before in several of our other videos, and there are several different domains that make up that quality of life, and they all kind of interact and feed upon each other, sort of the fabric of our lives, the way they interact. You can have the physical well-being, and those symptoms that usually the physician is primarily going to address might be made up of their function, their ability, their strength, their energy. Are they fatigued? Are they having symptoms of pain or nausea? How's their appetite? How are their bowels working? Are they having any bladder symptoms? But those are the body parts or body functions that we're going to address from the medical aspect.
And then there's the psychological well-being, which includes the control of anxiety, depression, sadness, pain, distress, which will cause emotions to erupt, happiness, fear, as well as your cognition and your intention.
And then the social well-being, and that we'll talk about mental health and our licensed clinical social workers, or LCSWs, in a different video. But the social well-being is going to be made up of the family's distress and how that affects the patient. What's the caregiver burden? We do have a video on caregiver burden. Roles and relationships of the family members do change as the illness progresses. What's their affection? What's their intimacy level? What are the changes in maybe sexual function? Are they concerned about their physical appearance? Has it affected their finances? All of that affects their social well-being.
And spiritual well-being is about suffering. It's about the meaning of the pain, religiosity, transcendence, hope, and uncertainty.
When you think about total pain and somebody maybe is anxious and they're worried about their physical appearance and maybe it's affected their finances and they're getting a little bit more anxious, and then you delve into it a little bit, you can see how maybe it's a spiritual concern that they really have. They're trying to define and learn and understand, comprehend what's the meaning of this illness and how it's affecting me. And so that's what we use our chaplains for, is to help that aspect so that we can help their quality of life be improved overall.
Therefore, if you fail to look at the emotional, social, psychological, and spiritual components, then you're not treating the whole person. So you're not going to have relief of suffering.
To look at their spiritual needs, patients that are receiving palliative care, patients that are receiving hospice care, they're getting that team approach.
Mm-hmm.
And we want to try to connect their faith and their beliefs with their practices or their religion as best we can to try to help manage their symptoms if they're having spiritual pain. If we can better understand what gives their life meaning and we can explore their remembrances and the things that are important to them, make sure that that individual has forgiven themselves or has forgiven others if they're carrying that type of burden, it's really going to help them. And in the process of learning that information, a lot of times they're going to share their life story, which in and of itself can be very healing.
Yeah. For physicians, where I normally do a spiritual assessment is during the part of our social history. We always gather information about what the patient was like previously, and it's really important to ask what type of goals that they have for palliative care. And then we're able to determine the patient's needs by discussing it. We try not to look at it as the elephant in the room. We want to normalize speaking of spirituality. And then we also have to understand that not every spiritual person has a religion related to it, or just don't assume, but based on the patient's religion, what that means to them. So what you need to do is ask open-ended questions like, what does that mean to be this religion? Because for everyone, it could be different.
So that's not our area of expertise, the spirituality portion. That's where we utilize our chaplain services. But we do want patients to understand that they matter. We want patients to understand they're loved, that they're cared for, that they have a voice, and that they're worthy. We want them to know that they are important and they're respected and their feelings and thoughts are valid.
We really find that when you discuss the spiritual aspect, it normalizes it for the patient, so then they're willing to open up about it in the future.
patients may not be willing to share that information unless we ask. And I know sometimes physicians are uncomfortable bringing it up, but it's just like telling the prognosis to a patient. A lot of physicians are uncomfortable with that as well. And it's our responsibility to address that for mind, body, spirit, for total pain management, so that the patient can have that best quality of life. We need to assess all of these so we can better care for the patient.
Yeah, we ask questions like, are you at peace? What is important to you? What gives you hope? Because sometimes you feel like when you lose your autonomy, there is less hope. Try to encourage the patients to talk about their feelings by using open-ended questions. Listen for the clues that the patient is struggling with spiritual issues. If you're listening, you can really pick up key points. They might speak about that they're searching for meaning, their feelings of isolation, the fear of the unknown. These are all big factors that you need to put into play when you're invoking the interdisciplinary team.
And as we've talked about before, the chaplain's importance, we just can't do without that chaplain. And we do have a couple of videos that we've interviewed a chaplain, and he's provided those thoughts. And if there's more interest, we can certainly have Chaplain Skee interview with us again. If there's specific questions, please let us know and drop a comment below. But we can't ignore this aspect of care of spirituality.
There are two common tools that we use to assess spirituality. Physicians we always have these tools in our toolbox. There's the HOPE and the FICA, which are two spiritual assessments.
We like mnemonics.
Yes, we do. We really do.
Like mnemonics and acronyms.
Yes. So we're going to be discussing them a little bit more in detail. But they're initial screening, and that really helps get the open-ended questions answered.
So the FICA is a spiritual history tool that we use. And the F is faith and belief system. I is the importance. C is community. And then the A of FICA is how we address that in their care. So for faith, we want to just ask, do you have spiritual beliefs that help you cope or that you rely on to give you strength? And we typically, when we ask that, that's when I like to tell them, we have a chaplain as part of our team. In the hospital, he typically rounds with us, or she, depending on who's on service. But we usually have a chaplain that will round with us. And so it's just a natural transition. And they get to hear a lot of the history that the patient has provided. And then if I can ask that during the social history, it's a nice, warm handoff to them so that they can ask their sets of questions. For importance, one of the things I'll hear the chaplain ask is when a patient tells us what their spiritual beliefs are or what the religion history is, he'll just ask them, and what does that mean to you? What does that look like for you? And so for some people, they'll just tell us it's a dietary need, or it's a time of the day that they have a need for privacy, or that they have a pastor, or they have a church or religious service. And sometimes it's just that's the way my family was brought up. It's not really that significant or something that I really practice. But telling us what that importance is helps the team understand that, that is something that we want to include for them. We want to know about the community, whether it's a spiritual community or religious community, how that factors into what their belief system is.
And it could also provide support. If they're already active in the community, it's really nice for the chaplain to speak to the religious leaders, to maybe have them come visit the patient in the hospital or whichever setting they're in.
Because our chaplain doesn't replace their pastor. He doesn't try to convert them to a particular religion. He wants to meet them where they're at. And many services, whether it's the police department, fire department, a lot of companies, certainly at the VA, we have chaplains, and many of them are specially trained, have had a lot of education in their background so that they can address the spiritual needs of many different belief systems.
The HOPE tool is H stands for hope, meaning, comfort, peace, strength, love, and connection. O is organized religion. P stands for the personal spirituality and practices, because every person is an individual. And E, effects on the medical care and end-of-life issues.
Sometimes we'll learn through obtaining a spiritual history that the patient may have significant ties from their childhood or sometime maybe in their adulthood with a particular religion, but they're not actively practicing that. But they still have those tight ties to a particular religion or a particular belief system. And that's helpful for the team to make sure that we have that in mind when we're caring for them. When a patient voices their distress, and if they're feeling abandoned, whether it's, by God or by a community, we can help address those needs and help them meet that part of that desire to feel included once again.
Yeah, it's really important. There's a lot of maybe religious patients that are faced with terminal illness and they feel as though God has failed them. So it's really important to bring the chaplain in so he can help, or he or she can help them process their death and alleviate some of their suffering.
Some cultures, some beliefs have a thought process that pain is a normal part of the process of dying, and it's important for us to know that because we truly don't want someone to suffer. We want to manage all that pain, but for some, that's just part of their culture, part of their belief system, and that's important for us to know. We want to ask about these things because if we don't ask, the patient may not tell us, and that's an important part of their quality of life, is to make sure that we understand what their needs are. We want to help them and help their family process why me, what's happening to me, how am I going to be remembered, what's the importance of this, so that they can find a sense of peace in all of the ordeal of these changes.
You will notice when patients begin the dying process, they do automatically withdraw from the living and become more isolated, but it's really important to make sure that you're ascertaining if there's any spiritual distress that contributes to that, so they can allow them to have a peace at the end of their life. A lot of times patients are afraid of being alone. Even the families might be afraid of being with the patient for what if they pass. Some patients will refuse care, saying they're scared or they're worried, they're depressed, and they're not at peace. These are all signs that there could be a spiritual component to their distress.
And if we can address those spiritual needs, we're certainly going to have more success dealing with their physical needs as well. So that is a key component to managing that suffering.
I really want to just reiterate what Dr. Bone says. This is the most important takeaway from our lecture, is as palliative medicine physicians, we address the total pain, and that will allow patients to pass peacefully. And sometimes that is missed in non-palliative patients, just general geriatric patients in the hospital, but we need to capture that because that would really alleviate a lot of suffering and even reduce hospitalization stay once you ascertain what's actually going on with the patient.
And we absolutely encourage families to maintain their faith and belief system, because many times we're told, I'm praying for a miracle. I want to get a miracle. God is going to give me a miracle. And I fully believe miracles are given every day. It may not be the one we wanted. It may not be the one we asked for, but I'm certainly not going to take away someone's hope. I certainly don't want to tell them, you're not going to get a miracle, because miracles do happen. And if we address that we also are hoping for you to have a miracle, it's just that we are also concerned about what the book says, because that's where our learning comes from. We are both people of faith, but we also have trained.
Yes, and I really think it's important to include the whole family when you're looking for a miracle. I can't tell you how many younger patients I've cared for with children that really believe that they weren't praying hard enough or quiet at church enough, and this is why their loved one was passing. It's a really horrible situation for the children to be in.
So we want to try to enable that family for that healing, and that's where we really need the expertise of that chaplain to address these things, because that's not something that we're trained in. There are so many barriers to spiritual care. Sometimes it's just because of the healthcare system is looking at things as a way to fix things or solve things. And for our standpoint, we realize that life is finite and people are mortal. And so we want to normalize that dying process, but we want to make sure that we have as much time to prepare physically, mentally, and emotionally for that death, because we don't want people to have regrets. We want every day to be the best day, and we want those patients and families to have as much healing in the process as possible.
Also, there's times where patients may feel that their clinicians rush. So, a lot of times, physicians may feel like they don't have enough time to discuss this. They have several other patients to see, and they just don't want to put the time in because they know it's going to take a lot of time. However, there's also another double edge to that sword, or the other edge of the sword is they don't feel comfortable with their own spirituality. That's what I often see in my practice of medicine. So if you're not feeling comfortable with it, it's not something you are going to want to discuss. So it's really important for physicians and other clinicians that are going to be giving direct care to patients to check in with themselves before they go into that room, so that patient has your individual attention and can understand that this is not coming from you. It's you as a professional and how to help them process their dying and their spirituality.
And I appreciate it when I go into a patient's room, if the patient or the family addresses that spirituality with me. If there's alignment, I mean, that's terrific. I'm still, like I said, not a trained individual for spirituality. I'm certainly not a chaplain, but if there's alignment in their belief system and my belief system, it certainly does make things a little bit more direct and a little bit more simple. But if they can let me know what their spiritual needs are, I can involve the chaplain who is educated in all of those spiritual concerns, and then they can directly communicate that. And I can tell the patient, this is not something that, I'm highly educated in, but I can align myself with them. I can provide that empathy and tell them, I'm so glad you told me this, so that I can make sure that the other team members come by and that we work together with you and with your family to address your spiritual needs.
And to not judge them. So I think that's really important.
We have another acronym for you. We're going to talk about the AMEN protocol.
Yes. An AMEN protocol, the A stands for affirm. So we want to talk about the patient's belief, validate his or her position. And an example of that is Miss X. I'm hopeful that your spouse makes a full medical recovery too.
And then the M would be to meet that patient and family where they are and let them know that we also are hoping for them to receive a miracle.
E stands for educate, from the role of a clinician. And I want to speak to you about some of your medical issues. It is important for us to always educate because we are the medical experts.
And I like for the patients to educate us too. So it's us educating the patients about what we know and what we understand, but I also want to make sure they educate us about what they know and what they understand, and educate us about what their belief system is.
Absolutely. The N stands for no matter what. This is an affirmatory statement that basically means we are not going to abandon our patient and family. We're committed to, regardless of whatever their beliefs are, to honoring their wishes. No matter what happens, we will be there with them every step of the way.
So what we say with hospice patients and palliative patients all the time, we want to accept you where you are, and we want every day to be the best day with your symptoms managed as best as it possibly can. And we're going to do everything we can to extend your life and give you the best quality of life, but we don't tell you what that quality of life means to you. You tell us what quality of life means to you.
Yeah, and we don't judge your quality of life. So we may have patients that have different qualities of life that they're okay with living, and that's okay.
We want to address the spirituality because when we do, those patients have less depression, they have less anxiety, their quality of life as they approach the end of life is better for them as well as for their family. There's less of a sense of despair or loss, and the patients feel like they've had that time for healing with their family members and with themselves, because sometimes what they need to do is they need to forgive themselves.
Yes, forgiveness plays a big role in spirituality. I really think it's important for us to talk about hope again. We don't want to ever give up hope for a miracle. We always hear things, we want to do everything that's possible. I believe, and we both believe, hope is the last thing to die. So we never want to have them feel burdened that we're going to give up hope just because they're dying.
And I always tell patients and families that hope needs to be alive, it needs to be dynamic. And by that I mean it needs to be allowed to change. When you were 6, you wanted something different than when you were 16, than when you were 66. And there were multiple hope changes throughout your life. But now that life is short and you have limited amount of time left, I need to know what that hope looks like. And certainly hope for a miracle, but let you hope for something that I might be able to assist with, because I can't hope. I can hope with you for the miracle, but I can't provide that miracle for you. So give me something that I can do so that I can help you.
We've learned a lot today about spirituality and the changes and in the quality of life when patients are faced with the dying process. It is really important as clinicians to involve other team members. Don't take on the burden yourself, because when you are dealing with someone that's chronically ill, there's a lot of stressors that come out. The spiritual needs need to be met by the spiritual counselor or the chaplain that's available to you. We always work in a team. We really believe in the mind, body, and spirit connection. And by working in team, we're really able to help that mind, body, and spirit be connected to hopefully have the most peaceful passing as possible.
So as a patient, my advice to you, my request to you is please allow all the team members to visit with you and to interact with you, interact with your family, and access the system. If you're on hospice service, you're receiving all of these service. All of these team members are going to come to your home, and they're going to meet with you on your timetable. And just like I used to tell my kids, green eggs and ham, you give it a chance. Give them the opportunity to interact with you and to try to help you.
It's important to have the whole team there, because you just don't know what you're missing without them, right?
Right.
We really appreciate you taking the time to listen to this video. We hope that you found the information to be informative.
If you've got thoughts you want to share with us or with others, please don't hesitate to put it in a comment below. If you need to send us a more personal message, please use our email address.
Yeah, and thank you so much for joining us.
Bye now.
Bye-bye.